Hello everyone. I'm excited to be here today to talk about a topic that often sparks a lot of curiosity and misinformation, the relationship between diet and skin health. For years, we have heard countless myths about how certain food can magically transform our skin, from chocolates causing acne to sugary drinks leading to wrinkles. These dietary claims often seem to be too good to be true. In this video, we'll dive into some of the most common diet myths related to skin disease. We'll separate facts from fiction, explore the science between these claims, and discuss what you can truly do to nourish your skin from inside out. First, let me set the context. We are in an era with easy, free access to a wealth of information, some good and some unbelievably bad, terrible advice. Patients have difficulty figuring out which information to take in. This is the typical path taken by a patient in India to a modern medicine doctor. Unlike in Western countries, we do not have a formal referral system here in India. The patient also has difficulty figuring out which specialty doctor to consult because anyone who treats skin disease here becomes a skin doctor. Delay in reaching out to a skin doctor may vary because of various reasons: cultural beliefs and practices, financial constraints, lack of access, fear of doctor or hospital, misconception about illness, and social stigma. Take it from me, as a dermatologist, a dermatology consultation in India often involves a question: doctor, I'm avoiding this for my skin disease because of my friends, family or voice doctor has advised me to avoid it. Should I eat this? What can I eat? Many Indian skin disease patients believe that diet affects their skin condition. You need to understand human behavior first to make sense of everything. Most humans operate in this world with beliefs that are based on subjective, emotional and non-verifiable information, and a very few based on objective, rational and verifiable facts, which are exact opposite. In India, every patient believes that each and every skin disease is caused by either diet or drugs. Our beliefs are based on our childhood experience. Number 2, the community from which we hail. Number 3, the place where we reside. Number 4, how much we are educated. Number 5, how we interact with technology. Number 6, and the ability to use the thinking part of our brain. It is a well-known scientific fact that dietary changes in certain skin disease can improve them or prevent them. I have tried to make it interesting. With these things in mind, let us jump into the topic. The role of diet in development of skin disease can be classified into definite and indeterminate. In nutritional disorders, the quantity of food eaten is the problem. In metabolic disorder, there is a problem with how the body processes the diet you take in. In few diseases where the role of diet is certain, diet plays a central role in disease process. The first section will cover skin manifestation due to nutritional disease and nutritional deficiency and excess. We'll be seeing the main clinical features and dietary modifications required. Nutritional deficiency always occurs in one of the 5 backgrounds. Number 1, the most common cause is in reduced intake of diet, which might be due to economic reasons in third world countries. In developed countries, doctors encounter a different subset of patients. In a young female, it might be due to fat diet or anorexia nervosa. Alcohol abuse and addiction are some of the common cause of malnutrition in males in India, and economic background does not matter. If the patient reports adequate intake, we think of malabsorption due to gastrointestinal disease or surgery as a causal factor. Let us see the difference between marasmus and kwashiorkor. In marasmus is a severe form of malnutrition, is caused by a chronic reduced intake of carbohydrates, proteins and fat below the required dietary allowance. This leads to utilization of reserves. Consequent muscle damage leads to a wasted appearance. Marasmus in Greek means withering. Skin proteins are also not spared. Ultimately, the skin becomes dry and wrinkled. Marasmus patients have the risk of hypothermia. Lanugo hair is believed to protect them from hypothermia. This is the complete constellation of symptoms of marasmus. The word kwashiorkor originates from the Gaul language of coastal Ghana. It translates into the sickness the baby gets when the new baby comes. In Kwashiorkor, the protein deficiency leads to reduced albumin levels. A pot belly occurs because of ascites and hepatomegaly. The flag sign is not universal. The protein intake is waxing and waning. During improved nutrition periods, the melanin forms, and the opposite happens when the protein is deficient. This leads to appearance of bands of pigmentation and reduced pigmentation in hair, which appears like the flag of USA called the flag sign. These are images of the past. The one on the left is from a child during famine in Africa, and the right is from a prisoner of war in Germany. Have you ever wondered why marasmic patients do not develop edema? Marasmic patients are listless due to calorie deficiency, and their fluid intake is reduced because they do not take enough fluids. This entity is called Marasmus Kwashiorkor when both occur. We may encounter these situations in India in future due to climate change and geopolitical conflicts. Next, we'll move on to a specific micronutrient deficiencies. The absence of zinc causes a defect in protein synthesis in hair and skin, leading to a breakdown of skin barrier. Low zinc leads to symptoms of an eczematoid eruption or vesiculobullous eruption in perioral, acral and perianal areas. Zinc deficiency in children leads to additional symptoms of stunted growth and delayed puberty onset. Diarrhea occurs due to decrease in secretion of pancreatic enzyme and consequent malabsorption. This condition is called acrodermatitis enteropathica. Zinc-rich foods include oysters, red meat, legumes and nuts. The recommended treatment for zinc deficiency is replacement with 1 to 3 mg per kg per day of zinc pills, provided a clear path for managing condition. Phrynoderma in Greek means toad skin. Here is an image of Phrynoderma. It appears as a small follicular papules, that is hyperkeratosis, that are often dry, scaly and rough. They typically appear on the upper arm and thighs and buttock. The rash can be itchy and painless. Phrynoderma is caused by vitamin A, B3 and C deficiency, as well as omega-3 fatty acid deficiency. Presence of eye symptoms and bleeding symptoms helps to narrow down on the cause. Next, a few words on nutritional excess. Nutritional excess is extremely rare and these conditions are not fatal. Let us first see about carotenemia. One of the common causes of carotenemia is excess intake of beta carotene, that is eating too much carrots, which can cause orange skin including orange palms. Here is a baby with carotenemia. This is different from jaundice, characterized by yellowish discoloration of skin and sclera. Second condition involves excess lycopene intake, that is eating too much tomatoes can cause lycophenemia. This slide marks the end of first section. In the next section, I'll be covering metabolic disorders. Metabolic disorders are conditions that affect the way the body processes food, energy and nutrients. It can involve carbohydrate, nucleic acid, protein or fat metabolism. We'll be seeing these disorders shortly. What is a metabolic disorder? An enzyme's deficiency or reduced biological activity results in substrate accumulation and lack of product. Clinical manifestations are due to toxicity of substrate or due to deficiency of the product. Exceptions do occur. Most metabolic disorders are genetic. Let us first look at one of the exceptions, a common disorder, gout. Gout in Latin means drop. Gout is caused by buildup of uric acid due to excess production or decreased elimination of uric acid. Excess uric acid crystallizes and deposits in skin, joint, triggering an inflammation. First is a picture of gout in the foot. Symptoms include pain in the grade 2. Acute attacks, when treated inefficiently, can lead to chronic gout. In the skin, they appear as yellow, white, firm nodules over earlobes and hands, sometimes painful. Acute attacks are terminated with anti-inflammatory drugs. Anti-gout medications help but not diet. Diet is a part of lifestyle change that patient with gout has to adopt. What is good for gout? Low purine diet. Let me explain. Uric acid is a breakdown product of purine. An exogenous source of purine is from the diet. Green leafy vegetables, red meat and fish are rich sources of purine. Alcohol is notorious for increasing the production and decreasing the elimination of uric acid from the body. These food precipitates gout. Avoiding purine-rich food is advised. Next, I'll cover a disorder in protein metabolism which follows the rule I told you earlier. What is phenylketonuria? Phenylketonuria in short is called PKU. PKU is caused by absence of enzyme phenylalanine hydroxylase, which leads to buildup of phenylalanine and deficiency of endogenous tyrosine. A mutated chromosome is located in chromosome 12. Enzyme deficiency is diagnosed by a heel prick test during newborn screening in the Western countries. Hyperphenylalaninemia affects the eye, brain and skin, and in case of reproductive age group women, the above said organs can be damaged in a developing fetus. One of the effects of PKU is the absence of tyrosine in diet, which leads to decreased melanin production. This can lead to manifestations of blue eye, blonde hair, serving as a potential symptom of decreased tyrosine level in the blood. Treatment mainly involves diet changes as soon as the diagnosis is made to limit damage. Look at the Coke label. Warn these patients to avoid aspartame and phenylalanine. A low protein diet is advised. Tyrosine, a non-essential amino acid, now becomes an essential amino acid in this patient. Synthetic diet with all amino acids except phenylalanine is also available. A mix of these forms a semi-synthetic diet. A diet restriction should be strictly followed by phenylketonuric pregnant women. The point to note here is that even though the fetus may have normal phenylalanine levels, the maternal hyperphenylaninemia can still cause damage. Next, we'll see lipid disorders. What is Refsum disease? Refsum disease is a disorder of lipid metabolism. That is a deficiency of phytanic acid oxidase enzyme. The phytanic acid accumulates in the myelin sheath and damages the nerves. Symptoms start from childhood and they keep progressing, knocking off the eye, brain and the nerves and ears. Adult Refsum disease major symptoms include night blindness, tunnel vision, sensorineural hearing loss and a lack of balance. Zellweger syndrome is different. Zellweger syndrome is a fatal disorder caused by absence of peroxisomes. The child rarely survives beyond infancy in this case. 25% of patients can have ichthyosis. It is important to note that ichthyosis is due to abnormal lipid accumulation in epidermis leading to skin barrier disruption. Treatment is simple. Avoid phytanic acid and phytol. After diet restriction, skin changes are reversible but not the neurological changes. I'll talk about another lipid disorder before concluding the first subsection. Xanthomas, a very common in today's practice. In short, xanthoma is a lipid accumulation in the skin due to increased bad cholesterol in the blood. This hypercholesterolemia has multiple causes like hypothyroidism, diabetes. When these is more than one lesion, that it is called xanthomata. When it is widespread, it is called xanthomatosis. The disease is characterized by large, well-demarcated yellow plaques or orange-red papules in trauma-prone sites. These are nothing but deposition of excess lipids in the skin. Deposits along the tendon are called xanthoma. Deposits in the palm are called palmaxanthoma. Deposits in the eyelid is called xanthelasma. And tubuloeruptive xanthomas can occur in the trunk and limb. Treatment is a lipid lowering agent followed by a vegan diet. I'll explain the details of a vegan diet in the forthcoming slides. For time being, just remember vegan diet. We are moving on to the last subsection in this section. In this subsection, we'll be seeing how diet plays a role in etiopathogenesis of the diseases. A casual role can be conclusive, possible or suspected. These diseases are widely prevalent in the community where maximum misinformation about diet circulates. First comes DH, Dermatitis Herpetiformis, autoimmune disorder. Celiac disease is an autoimmune disorder triggered by gluten. DH is a skin rash caused by gluten sensitivity. This is the classical photo of a DH rash on the elbow, itchy red bumps affecting the elbow, lower back and nape of neck. I'll be discussing the pathogenesis in detail because the causal role of diet is definite here. It involves 5 steps. 1. Gluten ingestion. This is the primary trigger. We'll be seeing the sources of gluten in later slides. 2. Immune response. Gluten is broken down into smaller peptides which are then processed by immune system in individuals with DH. This process leads to an abnormal immune response. Autoantibody production. The immune system produces autoantibodies, primarily IgA class A antibodies that target tissue transglutaminase. Skin deposition. These autoantibodies cross-react with epidermal transglutaminase and deposit in the dermal epidermal junction of the skin, causing inflammation and tissue damage. In celiac disease, the gut is primarily affected. You can see cross-reacting antibodies here. Finally, number 5, blister formation. Neutrophilic WBC mediated inflammation leads to formation of blisters, which are the hallmark of Dermatitis Herpetiformis. What is gluten? Gluten is a protein in wheat, rye, oats and barley. Treatment is simple. It is the same for both celiac disease and Dermatitis Herpetiformis. Avoid the primary trigger, gluten. Following a gluten-free diet, which includes alternatives such as rice, potatoes and corn, is the primary treatment for both celiac disease and Dermatitis Herpetiformis. However, it is important to note that despite a gluten-free diet, few patients don't achieve remission, which means their symptoms may not completely disappear. For these patients, iodine restriction can be beneficial. Iodine is believed to increase neutrophil chemotaxis in the skin and gut, leading to worsening of rash and diarrhea. The second line of diet restriction for these patients include restricting iodine, restrict fish, iodized salt and kelp in Japanese cuisine and Korean cuisine. Diet restriction is followed by medical therapy. The data I have presented till now is backed up by solid clinical evidence which will stand the test of time. Next set of disease I am going to talk about are theories that suggest a link between food and pathogenesis. More research is needed to confirm this relationship. What I mean here is the concepts are subject to change in future. Acne in Greek means pustule. Symptoms of acne include blackheads, whiteheads, pimples, cysts and nodules in the face and trunks. Unlike other diseases, restricting diet in acne can be helpful sometimes. This must be communicated to the patients clearly. What causes acne? Acne pathogenesis involves a complex interplay of factors including hyperkeratinization, bacterial colonization, hormone influence and a genetic predisposition and environmental factors like diet, which plays a minor role. Does diet affect acne? Absolutely, but it is important to remember that it's not a miracle cure. Both keto and paleo diets have shown to mixed results in hormonal acne. Look at this chart. High glycemic index food that rapidly digests or absorbed by the body causes a sharp spike in glucose levels. Example, sodas, colas, ripe bananas are believed to trigger acne by worsening hormone-induced inflammation. However, with right diet modification in conjunction with other treatments like comedolytic agents, antibiotics, retinoids, you can take control of your acne. I believe a good dietitian can give you a customized anti-acne diet plan made of low glycemic index food. Symptoms of atopic dermatitis are characterized by eczemas in bilateral flexures in older children and adults and extensor in infants. In acute stage, these eczemas are extremely pruritic, oozing and erythematous papulovesicular lesions. On scratching, erosions appear and reach a subacute stage where crusted yellow plaques are predominant. On further scratching, the skin becomes thick, pigmented with increased markings called lichenification. This happens when a genetically predisposed individual with epidermal barrier dysfunction and an abnormal Th2 response encounters an allergen in the environment. These are the pictures of different stages of eczema. Common food allergens in AD include wheat, fish, milk, eggs and peanuts. Avoid them after a dermatologist consultation if they trigger eczema. The role of prebiotics in improvement of AD has gained a lot of traction lately and it's yet to have a meaningful clinical impact on patients. Let me move on to the next topic, which I really like because ACD, a dermatologist's work is like that of a detective. The eczema pictures are repeated to stress the importance of identifying allergic contact dermatitis. There are 3 stages: acute, subacute and chronic. The first allergen will be latex rubber. This is an occupational disease affecting healthcare workers and rubber industry workers. Mainly, it elicits a type 1 or type 4 hypersensitivity reaction. The focus will be on type 1 hypersensitivity reaction for now. Urticaria can develop at the site of contact with gloves or condoms. Latex allergy can occur when wearing latex gloves or private parts after wearing a latex condom. When starch powder in the gloves dissipates in the air, it can cause irritation in the eye, nose or even lungs, leading to watering, itching of eyes, coryza and asthma. If the reaction is severe, death can also occur due to anaphylaxis. 30 to 50% of these patients can have allergy to avocados, bananas, peaches, tomatoes, and it can trigger a similar reaction to what we seen before. It's called the latex root syndrome. Advised to be avoided in this condition. Second allergen is Balsam of Peru. It is from this plant saps that cinnamaldehyde, an essential part of cosmetics and perfumes. The site of involvement depends on the type of product used. Scalp in the case of shampoos and conditioner, skin fold in the case of perfumes, and sun exposed areas in case of sunscreen. Balsam of Peru has more than 10 vernacular names. Here is the complete list. In case of doubt, you can check the ingredient section of the product that you are using. Cinnamaldehyde is present in cinnamon, citrus fruit peel, and vanilla flavored food items. Clinical features depend on the mode of exposure. Eating these food items can cause perioral and perianal dermatitis, and handling these foods can cause hand dermatitis. The last allergen for today will be nickel. Systematic nickel allergy syndrome affecting the body can also be seen. Apart from these, patients can develop pemphigus. This is a picture of nickel allergy, that is pemphigus. Multiple saccharine-like itchy blisters are seen, affecting the palm and the soles. Diagnosis is confirmed by the patch test. Nickel containing objects should be avoided. Nickel is universally present in the diet. There is no nickel allergy diet or food because it is hard to eliminate nickel from your diet. The only option is to manage pemphigus symptomatically. The following disease we are going to see is Pemphigus vulgaris. What is Pemphigus vulgaris? Pemphigus vulgaris in Greek means blister. This is an autoimmune blistering disorder characterized by generalized blisters. This is a photo of Pemphigus vulgaris which shows peeling and erosion of the skin and mouth. Nikolsky sign will be positive in the case. Pemphigus erythematosus also looks similar. What is the pathology outline? The antibody is produced against intercellular junction proteins called desmoglins. DF image shows the antibody deposits in the skin. This leads to formation of a superficial fragile blister by a mechanism of acantholysis. This slide is a summary of chemical content in the food. Isothiocyanates are believed to lead to acantholysis. Phenols can cause allergic contact dermatitis and are believed to lead to acantholysis. Thiols, tannins can cause in vitro acantholysis. As you can see in the diagram, a food product can contain more than one of the 4 instigating chemicals. Garlic contains thiol and tannin, mango contains phenol and tannin, and these can lead to blistering by more than one mechanism. Diet modification can be regarded an option after systemic immunosuppression is optimized in a patient who is frequently relapsing after common triggers like infection are ruled out. Next on the list is Psoriasis vulgaris. Psoriasis vulgaris presents as well-defined erythematous scaly plaques symmetrically on extensor aspect. Is psoriasis an autoimmune disease or a genetic disease? Well, the answer is complex. Psoriasis is an autoimmune disease that can occur in a genetically predisposed individual with overactivity of the immune system, especially IL-17 and 23. Encountering triggers like infection, stress, medication, etc. Diet can indirectly worsen pre-existing psoriasis. Let's see how. We are amidst obesity pandemic. Calorie excess in humans can lead to obesity. These cells act as endocrine organ themselves and lead to production of pro-inflammatory cytokines, worsening pre-existing psoriasis lesions in the skin. Alcohol intake can be a trigger for psoriasis. It can also be a sign of psychological impact of the disease on the patient. Alcoholics can neglect all food items except alcohol. A damaged liver due to alcohol can influence treatment decision. I have noted that this subset of patients have poor compliance with treatment. Cutting down on alcohol will improve the benefits for the patient. Psoriasis is a systemic inflammatory disease associated with metabolic syndrome and coronary artery disease. Making dietary changes such as reducing refined carbohydrate intake, saturated fat, plays a major role in managing comorbidities and improving psoriasis. Refined sugars found in products like colas and wheat breads are formed by refining process that strips dietary fiber from the food item. How to spot them on a food label? You should look for the suffix like O's, added sugar. The percentage of carbohydrate will be disproportionately high. This is a label from wheat bread. Here the carbohydrate amounts to more than 50% per slice of bread. Consumption of saturated fat increases bad cholesterol and worsens systemic inflammation. Hence, psoriasis is exacerbated. The addition of trans fat to food items is legally banned in most of the countries, but in India, it's still allowed at a limited level. This is an image of the past. Relationship of psoriasis with gluten is complex. For psoriasis patients with diarrhea, due to psoriatic enteropathy or inflammatory bowel disease, avoiding gluten in diet can be advised. A gluten-free diet may improve psoriasis in a few patients, but not all. Look for wheat, oat, rye and barley on the food label and avoid them. These dietary choices have been noted to improve psoriasis. Can psoriasis be naturally cured with diet? No. There are 3 dietary styles: vegan, Pagano and Paleolithic diet, known to improve psoriasis through anti-inflammatory effect. They differ in consuming a dairy product, refined sugar, non-vegetarian, processed food and gluten. Vegan is a plant-based diet. Milk and animal-based products are excluded. The Paleolithic diet focuses on unprocessed whole food from vegetables and animal products, excluding dairy products. Pagano diet, it's a restricted paleo diet with allowance for limited amount of dairy products. Are there anti-psoriasis diet? No. Diet has a supplementary effect on immunosuppression. It can improve both psoriasis and psoriatic arthritis but cannot cure it. I'll close this section with a slide each on urticaria and fixed food eruption. Urticaria affects around 10% of world's population at least once in a lifetime. This is an image of hive on the skin. It can affect the face and body. These are pruritic, edematous, evanescent, transient erythematous plaques lasting less than 24 hours. Crops of urticaria lasting less than 6 weeks are associated with food like oysters, peanuts, eggs and milk. The point is that food is not the only cause and is the least common cause of acute urticaria. Chronic urticaria episode last more than 6 weeks. Tomato and food coloring agents and additives are implicated. Food eruption is characterized by erythematous or slate grey, well demarcated oval macules on the lips and genitalia. Antibiotics and painkillers are the most common cause. There are case reports of food and food coloring agents being triggers. Avoidance of such food is advised after dermatology consultation. This is the last section of the presentation. The role of diet in hair fall treatment, rosacea and vitiligo has been blown out of proportion. The nutraceutical industry is a $1 billion market and pharma companies are very innovative in pushing hair supplements. Most supplements have minimal effects. Few supplements like green tea extract can be toxic to the liver. Protein, micronutrient iron and zinc are proven to support hair growth. The best vitamin for hair growth is biotin. These should be present in the diet for healthy hair growth in patients, especially in females with nutritional deficiency as the cause for hair loss. Nothing supports hair growth like hair care, a balanced diet, healthy lifestyle and adequate sleep. Pimples and acne rosacea are caused by a pathology in blood vessel. Acne is caused by clogged pores. Symptoms of rosacea include redness, flushing, papules or bumps, pustules and visible blood vessels. How do you get rid of acne rosacea? Antibiotics, laser are the best treatment options available for rosacea. Flushing in rosacea is believed to be worsened by hot beverages, coffee, tea, spices and alcohol. Avoiding these in the diet in rosacea can reduce flushing but not the pimples of rosacea. Vitiligo is an autoimmune disease leading to destruction of melanocytes and characterized by presence of well demarcated depigmented patches. In layperson term, white spots on the skin. How to cure vitiligo? Still we do not know. Is there a diet for curing vitiligo? No. Control vitiligo? You have medicines. I've heard some crazy myths about vitiligo and it is one of the most fear-mongering disease in the society. The role of food in worsening or improving vitiligo is controversial. Please keep in mind that there is nothing called an autoimmune diet for vitiligo. Antioxidants are beneficial to reduce oxidative stress in vitiligo. They are prescribed by few physicians when all other options have been exhausted. Here is the complete list of antioxidants. I conclude with this slide. If you have any queries, please leave it in the comment section below. Until then, bye. Thank you.